Hi, this is Sierra Perry, and I'm going to be talking about survivors of battery health concerns. Okay, a survivor of battery is someone who has been a victim of a violent crime that has been committed towards them, such as intentionally shooting, stabbing, or beating. Battery and assault are usually paired together. Battery is the physical act that results in harmful or offensive contact with another person without the person's consent. The definition of assault is intentionally putting another person in a reasonable apprehension of an imminent harmful or offensive contact. Physical injury isn't required. So, violent crimes in 2020 in the state of Utah was 100,000 per population. Utah was ranked number 11 in violent crimes nationally. From 2000 to 2020, Utah crimes have increased. 42% of adult homicides were domestic violence related. Children in Utah witnessed 22% of domestic violence homicides in Utah. 88% of men were perpetrators and 88% of the domestic violence related murderers. Nationally, the increase in battery and assault have increased during COVID-19 pandemic. In Portland, Oregon, police have recorded a 22% increase in arrests related to battery and assault since the lockdowns. San Antonio, Texas reported an 18% increase in calls pertaining to violence from March 2019 to 2020. The overall rate of violence in crimes nationally was 366.7 per 100,000 per population. According to the CDC, 1 in 4 women and 1 in 7 men will experience physical violence by their intimate partner at some point in their life. 5 million acts of domestic violence occur annually for women who are 18 and older, with over 3 million involving men. The population in Utah is 3.205 million residents as of 2019, and the population for the U.S. is 328.2 million since 2019. Um, I will say that it was the specific data for population for Utah and the detail of the population per capita was very hard to find all the information just because I don't understand quite what like per capita was, it like city, county. It was just a lot harder to find. So, social determinants of health, economic stability, so they have a lack of unstable income due to violence. Children in low economic households, incomes below 15,000. They don't have a high school graduation or at least one family member receiving some form of public assistance, increase their risk 5 times for maltreatment. Families with unemployment are at risk for intimate partner violence. Education access and quality, poverty and lack of access to education and resources for victims of assault. Low education attainment increases the risk for death from homicide. Quality of education determines on if the person will succeed in school and further their education. Poor education pushes those to drop out of high school, therefore increases their chance for abuse. Healthcare access quality, many victims of abuse do not reach out for medical attention. Resources, yes, they are available to those victims of abuse, but it becomes a little bit harder in those poor communities to find resources. So, neighborhoods, neighborhood and built environment, low income neighborhoods increases risk for violence and abuse just because there is an exposure of gang violence, random acts of violence that will increase for abuse. Um, yeah, in social and community, a lack of resources are provided in poor communities for victims of abuse. Reason for that is because businesses or investors don't want to invest in low income neighborhoods because there's a high rate of violence and it's not safe. So that is why it's a little bit harder. So, specific concerns, physical traumatic brain injuries, they are rare but serious. Concussions or loss of consciousness, which was more common, unfortunately. Physical pain, the psychosocial post traumatic stress disorders, depression, anxiety, fear, hypervigilance, and anger. Economic unemployed due to being able to work out of fear of an attacker, can't fully re engage due to cognition delays. So the root causes, I found 4 of them that were very, very specific. So childhood experiences, which witnessed or was a victim of abuse, Those can be root causes, major life changes like a significant shift in life, such as pregnancy or family illness, can lead to abuse. Economic circumstances, job loss, housing foreclosures, or debt can increase stress levels and can lead to violence. Insecurity, victim may try to leave the toxic relationship and the abuser will become more abusive to maintain control. All right. Maslow's hierarchy. So victims, they have not met that. The survivor with aftercare goal, they have met them. Unmet victims, they definitely have not met all of those needs. Survivors with aftercare goal, they won't need any because they should be meeting them. Excuse me. Anticipated functional level, victim, poor coping mechanism, and possible delays to functioning. Survivors steadily increasing at a functional level as their needs are met. Likely health outcomes, victims, depression, anxiety, fear, low self-esteem, eating disorders, PTSD, brain damage, and cognitive issues. Survivors, they obviously are healing through aftercare. They will have PTSD, physical and emotional scarring. Unfortunately, the victims and survivors will have very similar health outcomes. Okay, communicable diseases, HIV, AIDS, STIs, hepatitis B, TB, scabies, and lice. Victims are definitely at higher victims and survivors. They, more so victims are at higher risk for those. Excuse me. What can be done to decrease transmission acquisition is treating symptoms as soon as they are present. Education is key when assessing patients and possible communicable diseases. To stop the spread of the communicable disease, the patient must isolate themselves and begin medication therapy if it is available. Non-communicable diseases, yes, I see that I've put TBIs and pregnancy and those kind of things. Those aren't diseases or infections, but they are conditions that are non-communicable. So, for example, tobacco, hypertension, addiction to alcohol, tobacco, and drugs. Those ones, how they can be prevented or manageable is obviously with hypertension. With hypertension, you need to change your diet, exercise, and possibly medication treatment. Or with alcohol, tobacco, and drugs, you need to educate them, maybe help them find some resources to help them quit. But with TBIs in adolescents, how we can manage those certain conditions, for example, pregnancy, is birth control and safe sex, all those kind of things. So specific self-care and self-harm, intentional drug abuse and alcohol abuse, they usually drug abuse and alcohol abuse, they will use that as a self-medication because they're trying to medicate through the pain, depression, anxiety, fear of the abuse that they have gone through. What can be mitigated this problem is by teaching them proper coping mechanisms and how to deal with trauma. And therapy is a great way to help victims and survivors heal. Unintentional cognitive delays and physical injuries that has led to disability. Obviously, they can't help it if they've been abused to a point where it affects the way that they function. So the self-care deficits and can really be a problem for them. Risk for harm by others. Victims and survivors are at higher risk for being harmed by others and are at higher risk for harming others as well. It's the same theory as a child who's grown up in a home where there's a parent that has been abusive, and during that time, they think it's normal, and so then they grow up and they can either be a victim of it or they can be the abuser. Those who have been assaulted physically are more prone to being abused in the future by the same person or another person, especially those who are a survivor. They have been through it before, and sometimes they start to blame themselves and think that they have a right to be abused, which is sad and it's not okay, but it's very common. What can be done to mitigate the harm is providing resources to victims and survivors of assault. By providing resources like therapy, programs like CAPSA, group therapy, and can help aid the victim and survivor on building healthy relationships without assault. Um, the main goal of it is just we're here to help them, and how we need to stop it is by teaching them and helping, giving them that support that it's not okay to be abused. Anyway, this concludes my presentation, and I hope you enjoyed it. Thank you.